we try to be as helpful as physicians. We try to be as helpful as we can, but there are just some things that it's like an ice block. You can't break it that easily.
Exactly.
And it's good to know that you have other groups that can sort of help women navigate this.
It's a very comforting feeling, as we said before, to know that women have lived through this, that they're living their lives, they're working, they have successful relationships, and that there's somebody they can talk through the entire process. One of the major times, which shocked me, that's difficult for women is post-treatment. The survivorship.
Oh, that is the worst time.
Absolutely shocked me. I
can-
went with balloons and celebratory cards to the first woman that I had worked for and said, "Oh my God, your finish, this is so great." She said, "I am terrified. Petrified. There's no safety net. What do I do now?"
People stay here, they hug me, they cry.
What do I do now?
It's like you're cutting the umbilical cord.
Exactly.
Right? And it's
they
like
feel cared for and safe.
all the time that you're on chemotherapy, you're doing something. You're being very active.
Exactly.
And then all of a sudden, you stop all of it. And it's
Exactly.
like, what's going to happen?
Exactly.
Is it going to come back right away?
Exactly.
So many women come back and pay visits to the suite just because they want to kind of
They
keep
feel like
the contact.
they
you
feel
know?
safe.
It
So woman to
absolutely is
woman,
true.
what we're focusing on more now is some of the survivorship issues, because they do change. Issues change as time goes on.
That to me is the most important thing, because I think I can certainly speak from experience that when you stop the treatment, it's almost like you want to, it's not like you want to cut it off, you almost want to make it longer. All right, instead of cutting it off, how about I come back in 3 months?
Right.
Maybe I don't have to
Right.
come back, in 1
Right.
month.
Yes, yes,
And
yes.
just do a little booster.
Absolutely,
But
absolutely.
I
It makes you
think
feel
that
better.
for me, and in our talks throughout SuiteTalk, survivorship is so important for me, because within SuiteTalk, I want to bring up topics of there's the illusion that you're losing control and you have no control when you're going through treatment, where in fact in life you really don't have any control anyway. And there's just something about understanding that and giving yourself over, first of all, to the treatment, because you hit a wall and you really don't have control. You have to go with it. It's sort of like in the middle of labor and you're giving birth and you're like, I just want to take a break. You can't. It's it's going. You're on that
Right.
train. And the same thing during treatment. And in survivorship, you're still, thank God, living.
Right.
And instead of it being before and after, had it, don't have it, good, bad, it just is. And that sort of framework in your mind is so hard to grasp, because you're always wanting to categorize or, give me the thumbs up, and you can't live like that. You have to just live your life and roll with the punches, whatever it is. It's that's where meditation comes in, and being healthy and being outdoors in nature and appreciating and living in gratitude and saying thank you for everything that's going on. So sometimes it's a good thing. I mean, you've said that too, that you've seen patients where it's the best thing that ever happened to them in survivorship.
Right.
When after they get through all of that hardship, they sort of are so grateful for living. But those tools of how to deal with life after are sort of the same tools that you should be using throughout your life, but I don't know that any of us really do it on a regular basis.
But what is so intriguing to me when patients come here, it's almost like, what was that show that you lived in a different dimension? It's like you have this parallel life with
Yeah.
everybody else,
Mhm.
but everything is different because you learn, your vocabulary changes,
Exactly.
your priorities change, so many things change. And it's such a hard transition for women to make initially. But once you're into it, then, they know more about the white cells and the platelets and all these other things
know.
that I care to remember sometimes because, they're so on top of everything.
I think
And-
they know more about constipation than anybody. I
Oh,
think that's the
constipation is
reason
the big
they
one.
do.
That is the big one. I've given so many different remedies for constipation. I should write a book on constipation. It's,
Well, speaking of writing a book, what are some of, I know things that I've overheard is, can you get a manicure, pedicure?
Right.
Can you dye your gray hair? What do you do about constipation? Can I have sex? God knows I don't know anybody who wants to have sex, but I've heard this topic come up
Right.
because, it's still a partnership of some sort
right.
in a
It's-
marriage or whatever.
There are many, many questions like that, and you sort of
Give me some answers.
force yourself to be an expert on things that you really are not an expert on. But For going to a spa, a lot of people go away, they want to go to a spa, manicures, pedicures. I see no reason that you can't do it. I always caution people, don't cut the cuticles, have them push it back, because we are prone to more infections in around the nail beds when you're on chemos, and there's certainly some drugs that make you more prone to these fungal infections. And most women may not even be aware of that. So go easy on things like that. Of course, there's a lot of stuff about what kinds of nail polish you wear, because some of them have these
There are brands out
chemicals
there
in there, and there have been brands made specifically for chemo about the hair. I tell them don't use peroxide, and there's no real scientific reason why you can't use peroxide, other than the fact that when you're on chemo, your hair falls off, and you make your hair more brittle when you do those things. So just be sensible. I would.
What about tanning?
I really don't recommend tanning.
A lot of drugs make you sun sensitive.
Some of them specifically more so than others, like the Doxil, that class of drugs. You go in and you get a hypersensitivity, so you may sit in the sun, and normally you get a little red, but you're on those drugs and you're going to get bright red.
I was on Doxil, and she's like, just be careful of the sun. This was like July. Just be careful of the sun. I go, how long is this going to last for the summer? She goes, about 2 or 3 years. Thanks.
So I say block, and the higher the number, the better. And I mean, that's just what the American Cancer Society would recommend anyway, just to prevent skin cancers. But
a big topic, and this is a tough one. What do I eat? And I know that's the whole nutrition part as part of survivorship. I'm extreme, as you know, and she'll tell me that I'm too extreme. I'm vegan, I'm macrobiotic, I eat raw things, and to the point where I can make myself sick.
Well, the biggest topic is should I visit a nutritionist, and should I go on all these mega drugs? And that's really individual. Some people need to go to a nutritionist, whether it gives them some mental focus.
It's the control thing again.
Yes, again, yeah. It may be, or they really need it. I leave that up to the individual. What I don't usually support is when you have to take 30 tablets a day, and you're on these drugs. You just don't feel like taking 30 tablets a day, and these are supplements. So that's where I kind of draw the line with going to a nutritionist. I don't see anything wrong with going to a nutritionist. I don't see anything wrong going to an acupuncturist, actually. If you want to go on, it helps you. Some people do it for nausea, some people do it just to have...
It helped me enormously.
Yes, right, I know that. Or just to have a sense of calm during the whole thing. I'm open to that. I think we are very open as a group to things like that,
It's all about wellness, and
exactly.
The questions we get, how do I stay well, how do I get well? There's this fear, and also a lot of, in some cases, self-blame. What did I do wrong?
Right.
I didn't exercise enough, I didn't eat the right things.
Absolutely.
Whatever, stress, does stress cause it?
Exactly.
What happened? So how do I stay well? And that includes any kind of complementary therapies, it includes exercise, what do I eat? We're actually going to have a series of woman-to-woman reunions on the subject of how to stay well in survivorship. And I think that, for one thing, most important to women is that they want to feel that they're normal, that everybody else is feeling the same way they are. Am I doing the right thing? Am I doing everything I can to stay well? I think that women want to know that the way they're feeling, other women have felt the same way or are feeling the same way, and that's where our survivor volunteers come in. Yes, I felt that way. One of the biggest fears women have is when they have to go for tests during survivorship. Every 3 months, every 6 months, it's absolutely normal for anybody to feel fearful of those during those times.
Even the monthly CM125,
And
that's very
exactly,
anxiety-provoking.
exactly, very
I just had mine
anxiety-provoking.
yesterday, and I'm like, any results?
Sitting on
Any
pins and
results?
needles, right.
Exactly, and that's completely normal.
Yeah.
I can't think of any woman who doesn't feel that way. And knowing that is reassuring.
Yeah.
And there was something I was
Sort of.
thinking that women to women should probably do is work with physicians. I don't know if you've set up any programs for physicians. We run the gamut of physicians, those who will talk forever with the patients, which is nice with the patient, and those who don't have a minute other than to tell you this is what you do today, and then they push you out the door. And there has to be some kind of happy compromise on how physicians deal with patients, particularly patients with cancer who are going through multiple chemotherapies. I think that's very important. And I think also when you do talk to the patients about side effects and intimate matters. I think doctors need to be trained. I don't think that's something we really have to deal with. I mean, I look at residents
Yeah.
and they go in to see the patients, and sometimes I cringe. I want to die at the way they give them a result, or, you know,
It's awful.
and those things are so difficult to train people to do.
We do teach, we do talk to medical students.
That's
And
right, that's a
we
great
have
program.
a class that we go to, and the survivors tell their stories and talk about some of the issues and how to be a sensitive physician. I think part of it is time, and I don't know that physicians have the time to be trained in some of the psychosocial issues. I've gone to classes, I've taught in various venues about some of the psychosocial issues because it's so important. But in my experience, it's not their first priority often.
It's not, but it kind of should be way up there.
You know,
Yes, it
it's
should be
really
way up
the
there.
tough thing where, this is gonna sound very harsh, but if I go to the surgeon, I want the surgeon to be an excellent surgeon,
Mhm.
like, I want you to know this like the back of your hand. And the same thing with an acupuncturist.
You will overlook the bad bedside manner just to
Well,
get
I,
the surgeon.
no, I don't think bad bedside, but I'm not expecting someone to take me
Right.
through a whole process, because at the end of the day, my feeling is,
want a
nobody
good
really
job done.
knows how the cancer started. Nobody really knows how to get rid of it. We have another interview with John Martinetti, who will, is gonna talk about gene research, and you know, you certainly can say, oh, I have bad genes or whatever, but even talking to John Martinetti, who's an expert in this field, can't really explain why some people go on to survive and have no problem, no reoccurrence, and some other people that do.
Right.
And what factors in life, industrialized nations, diet, stress, bad marriage, whatever, what makes a reoccurrence without putting blame on the person? Is it internal, is it external, is it gene related? There's so many pieces to the puzzle where it's on me as the patient to educate myself, not to go to someone and say, fix me. Although I didn't go to medical school, I'm not a surgeon, I'm banking on that person to be expert in their field, and I really need lots of help from many different areas to educate myself on me.
But I
You
think,
know?
I think the patients that we talk to, the most important thing for them is to feel heard, listened to.
Right.
Do
True.
you hear me? I'm an individual. Talk
Yeah.
about my specific situation. Take the time, and don't dismiss me. Don't look at your computer. Look at me. Make eye contact. Pretty basic things. It's a big issue for women, and I think for patients in general, to have a doctor that you feel listened to.
You have to have the relationship with your doctor so you can ask questions. They can't be the be all or end
Exactly.
all, but certainly they should listen. I've been so blessed, thank you Buddha, thank you everybody, whoever's up there, that at least I have doctors that not only listen, but they're actively as part of that individualized plan, where if I say, listen, I'm doing acupuncture, I'm taking supplements, I'm doing traditional Chinese medicine, I'm getting a massage every 2 weeks, whatever it is, he'll like factor it into the plan, and almost, it's an education for everybody to see, well, if that's working for you, maybe I'll pass that on to someone else. To me, that's a great doctor, of just being.
Well, you know that doctor, your doctor, is listening to you.
Yeah.
And taking into consideration, and will remember the next time.
Right.
And I know, because I work with these doctors, that we worked as a team. And
Right.
very few doctors are like that.
But it's about what you said about feeling whole and, you know,
Mhm.
doing everything you can for well-being. And if those things help,
Exactly.
you know, most of this game is psychological. I mean,
You have to feel
patients who are
safe.
invested into their treatment,
Exactly.
you give that extra, you know, you bring that extra stuff to the table. It helps. Ultimately, it helps your survival. It helps how you
Absolutely.
handle the chemotherapy. There's so many ways that it's important.
You have to feel safe. And I really would say, if you don't feel safe and you don't feel heard, you should try to think about changing doctors.